So if a patient is in the hospital and they are able to walk about a little bit, we actually encourage them to move about. We order compression stockings, and we also give them smaller doses of the same blood thinner heparin. And that's usually what we refer to as a prophylactic dose. All of this with the intention of ensuring that this patient who has not been mobile, who has not been moving about for a period of time, now would not be as prone to forming a clot within the deep veins of the lower extremities.
How about recurrence? If a patient would have had DVT once, is there a possibility, a high possibility rather, that they would have that issue once more?
That would depend on many factors. For example, if the patient has an underlying condition that makes them prone to having clot form, for example, the malignancy, there are certain states that are inherited. They're called inherited hypercoagulable states. Those can potentially lead to recurrent DVT. And sometimes, even in a patient who doesn't have those risk factors, but has not been adequately treated, they can have recurrence as well.
Okay, so is there anything you'd like to add as we prepare to wrap up in terms of persons who would have had DVT, how to go about their daily lives, so as to be cautious?
I would advise that by and far, patients and people who have had DVT should attempt to be as mobile as possible. And if by chance they nevertheless encounter recurrence of these symptoms, to seek help as soon as possible. Additionally, I would definitely advise that when you are on treatment, to please follow up with your medical practitioner, because the monitoring that is done is to ensure that your blood is adequately thin. And if that is not done optimally, there could be a recurrence or worsening of it. So definitely not only seek medical attention, but follow up with the medical practitioner for the appropriate time period.
Dealing with DVT can become an emotional burden for some people, especially as it relates to staying on top of your treatment and having to remain strong for your family and loved ones. Apart from seeking local counseling and talking with your doctor, there are DVT support groups online where you can share your journey and get support from persons with similar conditions. Some online support groups include www.clotcare.org and www.stoptheclot.org.